Hi, my name is Dr. Phanindra Sudarshan. I'm a consultant orthopedic surgeon at Medfine Hospitals. This is my patient Mangal Shah, who came with a right open both bone leg fracture and was operated 3 weeks back. He came to us for a regular follow-up and he's doing well. And I'm going to ask him a few questions to know how his journey has been so far at Medfine Hospitals.
Doctor, can you tell me about what procedures and how the patient presented to you?
So the patient came with a history of an RTA, a road traffic accident, where he sustained open fracture of his right tibia and his fibula. So we did an open reduction internal fixation of his fibula and we did a closed reduction internal fixation of his tibia. And we had to do a extensive lavage and washout and deployment because it was an open fracture. Make sure that the infection is taken care of because he came with a background of diabetes. And this was done in the theater under spinal anesthesia.
Doctor, how many hours for the surgery?
So this is a complex surgery which took close to 3 to 4 hours in the theater where we had to do an extensive debridement of the wound. And because it's a spiral oblique fracture, it is very complex to reduce and we had to do a closed reduction. And we were very skilled and with the help of the staff, we were able to get a closed reduction of the tibia and did a plating of the fibula.
Sir, can you tell me where the surgery and so incision?
Right. So this patient had closed reduction for tibia. We had an incision given near the patella tendon and then had to do the insertion and the entry point on the tibia. And after we got a closed reduction of the tibia and confined on the C-arm, we did a incision around the lateral side of the ankle, which is for the fibula. And we had plated the fibula and did a nailing for the tibia.
What is the C-arm? What is the computer?
So C-arm is basically one of the form of radiological instrument which helps us to see the fracture and help us to know if the fracture is reduced. Under its guidance, we can be sure that the fracture is reduced into an anatomical reduction and with absolute stability or relative stability when needed.
Is any implant surface?
Yeah, we did use a nail to stabilize this long bone called the tibia, and we used a small plate to stabilize this small bone called the fibula.
What is the length of the implant?
So ideally for his patient, the length is something we calculate intraoperatively. So the length that we got for this patient was 10 millimeters in diameter, 330 millimeters in the length.
Will it stay inside the bone or other way?
So ideally, we let the implant stay inside the bone unless the patient starts experiencing any symptoms because of the implant, and then we'll ask the patient to come see us, and then we're going to examine him, and if needed, we can take the implants later once the fracture is completely healed.
It is always better to remove implants, right? Even the patient doesn't have pain.
No, we let the patient have the implants because removing itself is another surgery. It always comes with certain complications. So you always advise the patient to come for a removal surgery only when indicated. And regular removal is what we experience in pediatric fractures.
What kind of interest do you doctor in that MRI compatible or patient to restrict for MRI? Days like that.
Right. So the implants have two types. We get in stainless steel and also in titanium. The titanium implants are usually MRI compatible, whereas stainless steel implants are not MRI compatible. So it also depends on the affordability of the patients. When patients are not affordable, then we tend to use the stainless steel. And we make sure that the patient is aware that there's a stainless steel implants in the body so that they know before going to the MRI scans.
Oh.
Thank you.